Good evening, this is Dr. Paul. Thank you very much for tuning to our channel today. Today I want to talk a few minutes about pulmonary embolism. Before I go forward, I request you to visit our website at www.usmlevideos.net. That is www.usmlevideos.net. Let me talk a few minutes about pulmonary embolism, a very important topic for USMLE. Pulmonary embolism could be a dangerous condition, and many people survive with this, but it could be fatal in many others. Now, let me start with basics. You remember when you study pathology, we read about Warhorse triad. The Warhorse triad is the conditions of hypercoagulable states and venous endothelial injury, and thirdly local stasis, that is Warhorse triad. Hypercoagulable states like pregnancy or prolonged immobilization or dehydration, they predispose patients to pulmonary emboli. And also the beds, you see, most of the pulmonary emboli does not come from lower extremities or upper extremities. They come from iliofemoral vessels or pelvic vessels. So those are the sources of most of the pulmonary emboli. And when embolization occurs, these emboli, they move to the lungs and cause many consequences. The consequences depend upon the underlying cardiorespiratory status, whether patient can stand it. And some of these emboli are so massive that they actually produce a right heart, a severe right heart strain, and lead patient into shock and ultimately to death. These pulmonary emboli, even small pulmonary emboli, produce ventilation perfusion abnormalities and hypoxia. That's why we do ventilation perfusion scan, VQ scan, in the diagnosis of pulmonary embolism. Now, there are certain things we need to know when we study about pulmonary embolism. First of all, these patients develop right heart strain, as I said before, and they develop systemic hypotension and shock and fragmentation of these large emboli. They lead to migration of these small emboli to other areas of the lungs and potentially causing a havoc in the pulmonary system and ultimately leading to death. Now, symptoms and signs could be very non-specific. Patient can have chest pain or hemoptysis, that is coughing of the blood, or dyspnea and cough and anxiety, and even low-grade fever. And these symptoms vary and they occur in different combinations. Tachycardia, tachypnea can occur. And these symptoms, they are not specific to pulmonary embolism. So whenever you suspect pulmonary embolism, you should always have that high index at the back of your head and go for diagnostic tests. What are the most common diagnostic tests? First of all, chest x-ray. Chest x-ray is abnormal in many patients with pulmonary embolization, but it is highly non-specific because the things that we see can be seen in other things. Now, there are two things, Westermarck sign and Hampton's hump. These two are very important terms you need to remember. Westermarck sign and Hampton's hump. Westermarck sign is dilatation of pulmonary vessels proximal to the pulmonary embolus. And Hampton's hump is that rounded hilum that is away from the pleura. That is the Hampton's hump. Remember those two terms very essentially. Hampton's hump and Westermarck sign. Those are characteristic of pulmonary embolism. And then EKG. EKG, what you need to remember is S1Q3T3 pattern. S1Q3T3 pattern is specific to pulmonary embolism, but you don't see those things, those particular EKG changes in every person with pulmonary embolism. So S1Q3T3 pattern produced by that right heart strain produced by pulmonary embolism is very important. You should also do arterial blood gases when the patient will have that hypoxemia and hyperventilation, and that hyperventilation produces hypocapnia because that CO2 is exhaled outside. So hypoxemia, hypocapnia, hyperventilation are seen on the arterial blood gases. But when you have this patient in the emergency room, you don't waste your time with arterial blood gases. When you suspect it, the most commonly used imaging study is CT scan, that is a contrast enhanced CT scan. Now D-dimer. D-dimer is elevated in pulmonary embolism, but again, unfortunately, it is very non-specific. That means D-dimer elevation can be seen in many other conditions. But the good thing is when you see that D-dimer is low, you can rule out pulmonary embolism. That's the good part about D-dimer. Now, let me say a few things about CT contrast. When you use the contrast, you need to make sure that patient has good renal function, and if a patient is allergic to contrast, you need to pre-treat them with the steroids and Benadryl. And the other thing is next one, very important test is VQ scan. When CT contrast is not definitive about pulmonary embolism, you should go for a VQ scan, and it has higher sensitivity, and the radiologist would tell you whether the patient has high, intermediate or low probability for pulmonary embolism through VQ scan. Now the final test. What is the final test? The most definitive gold standard test for pulmonary embolism, that is pulmonary angiogram. Pulmonary angiogram, you see the blood vessels and you could see the emboli. So ultimately the gold standard is pulmonary embolism, the pulmonary angiogram. So when you see a patient, when you suspect a patient with pulmonary embolism, you should act very fast, because this condition could be a deadly condition. Now finally, a few things about the treatments. The most important things you need to remember is anticoagulation. First of all, unfractionated heparin, then low molecular weight heparin like Lovenox or Fondaparinux or Dalteparin. Those are the low molecular weight heparins. So most of our hospitals nowadays, they are starting with Lovenox and then slowly transferring patient onto Coumadin and continuing patient on Coumadin. So heparin is the most important thing you need to remember, and low molecular weight heparins have the advantage that you can send the patient home because you don't have to monitor activated partial thromboplastin time, that is APTT, with low molecular weight heparins. But if you use the unfractionated heparin, you should follow with the APTT levels. The other things are thrombolytic treatments and surgical treatment like embolectomy, remove that particular embolus using surgical therapy. So all kinds of treatments are there, but the most importantly, you should remember using heparin. Those are the things about pulmonary embolism. Please post your comments and also write your comments to me. Thank you very much. And those of you who are taking clinical skills, I recommend this book, USMLE Smasher. USMLE Smasher, I recommend this book because it has excellent patient encounters, and please get this book on Amazon or Barnes & Noble or Ex-Libris websites. Thank you, and also visit our website at www.usmlevideos.net. Thank you.